A very good morning to everyone. So today I'm going to talk about endoluminal robotic surgery, its current status and future possibilities. So I've divided my talk into these subheadings. I'm going to briefly talk about the evolution of endoluminal robotic platforms, what are the currently available platforms, what are their capabilities, their limitations and the challenges, and what is the future prospect of this modality of doing minimal access surgery. So we all know that the history of surgery is essentially the history of making the access smaller. So earlier it was all about open surgeries, and then we gradually moved from that into the era of minimal access surgery. And gradually over the last decade or so, we have been transitioning into robotic surgical platforms. So whereas open surgical era was all about giving larger incisions and having lot of post-operative morbidity, longer hospital stays and longer recovery on part of our patients, all that changed when minimal access surgery was introduced. Now we are operating through much smaller incisions, but with much better visualization also. This led to better surgical outcomes and early recovery for our patients. However, this modality itself has its shortcomings in the form of limited access and poor dexterity. Now, as we are slowly adopting and stepping into the era of robotic assisted surgeries, we are now being rewarded with greater precisions during our procedures, much enhanced dexterity, a 3D visualization. However, this platform again has its sets of limitations because of the use of rigid instrumentation. So, where do we go from here now? The question is, how can we further decrease the morbidity of surgery and make the procedures safer for our patients, but without compromising the quality and the surgical outcomes? What lies next? Well, the next frontier of surgery appears to be either two of these options. So either we could start operating with even lesser number of incisions, or just with a single incision, what we today know as laparoendoscopic single site surgical procedures, or we should try to go completely incisionless and start doing what we today call as endoluminal surgeries. Now, what exactly is endoluminal robotic surgery? So we are talking about going through the natural orifices and doing a procedure either within the lumen or through the lumen with the use of an operating robot. So this is going to make the surgery completely scarless and incisionless. If laparoscopy moved surgery from large incisions to small ports, the endoluminal robotics may move surgery to no ports at all. So talking about the different kinds of endoluminal procedures which can be done, there are basically three kinds of approaches. We can either go transoral and do esophageal and gastric procedures such as endoscopic submucosal dissections, different kinds of myotomies which could either be a POEM procedures for eclasia, it could be a G POEM or it could be a Z POEM for a Zenker's diverticulum. We also have the options of doing endoscopic sleeve gastroplasty, gastric fundoplications, even doing a transgastric cholecystectomy and appendectomy. Another option is to go transanal and again do procedures like submucosal dissections or even a full thickness resection via endoscopic approach. We also have the option of now doing transanal minimally invasive surgery, either laparoscopically or endoscopically or robotically. The third option is to go transvaginal and again do procedures in the pelvis such as a transvaginal hysterectomy or a oophorectomy or a tubal surgery or even a cholecystectomy or appendectomy. So what is the advantage of doing procedures via this approach? So of course, the first obvious advantage is improved cosmesis. No skin incision and no visible scar on the body surface. And because we are not going to give any scars or incisions to the patients, this is definitely going to bring down the incidence of SSIs, reduce post-operative pain, shorter recoveries, and early discharge from the hospital. There is less morbidity to our patients because we are avoiding the transabdominal routes now. And this is really important to improve the outcomes, especially in patients with multiple comorbidities or morbidly obese patients. So transluminal approach, such as a natural orifice transluminal endoscopic surgeries, have been attempted earlier also using traditional flexible endoscopes. However, performing complex surgical procedures such as a tissue cutting or suturing is technically challenging to do with these platforms. Traditional flexible endoscopes have challenges in the form of lack of instrument dexterity, there is no triangulation there, and the movements of the endoscopic manipulation are non-intuitive. Similarly, if we try to attempt and do a transluminal procedure using a conventional robotic surgical platform, the problem here is that we are going to use long and rigid instruments, which are very difficult to be introduced through narrow and curved anatomical pathways such as an esophagus or a colon or a bronchus. So these limitations of the conventional flexible endoscopic and rigid robotic system platforms are now being addressed by the introduction of flexible robotic surgical systems. And these systems have greatly improved our accessibility as well as the feasibility of doing endoluminal or transluminal surgical procedures. So a paradigm shift is happening in minimal access surgery, which is going to make it truly incisionless and scarless. So the various robotic systems which are approved and available for endoluminal surgical procedures as of today. The first flexible endoscopic surgical robot, or the micro finger as it was called, was introduced by the Nagoya University way back in year 2000. But since then, several flexible surgical robots have emerged. Among the long list of the platforms which are currently available, I'm going to focus only on the systems whose feasibility and efficacy has been validated either through ex vivo tests or animal trials or even human trials. Interestingly, among the long list, only a few have obtained either the FDA or the CE certification as of today. The first and the very interesting flexible robotic platform is this Flex robotic system coming from Med Robotics. This got its CE mark in 2014 and it was later also cleared by FDA for transoral procedures and colorectal procedures. This system basically contains a flexible robot assisted endoscope and compatible flexible instruments with 4 degrees of freedom and a steerable console. So just to convey the idea how the system is going to work, this is the Flex robotic system which contains this single port through which the flexible robotic overtube is advanced by the surgeon, and the surgeon is controlling this overtube sitting on the robotic console. This is flexible and can be negotiated through the narrow lumens of our natural orifices. Once it is in position, the flexible robotic endoscope is also introduced. So this allows the access through the natural orifices, allowing the surgeon to take this flexible robotic endoscope to the site of surgery. And once there, you are going to use the flexible robotic instruments like these, which are introduced alongside the flexible endoscope and help you do all the endoluminal procedures. This is just a demo video demonstrating that how a full thickness defect of the bowel wall is being closed by taking full thickness sutures using these flexible robotic instruments. It gives you a very good view, depth perception, as well as the triangulation which is required to perform these kind of procedures. The next system which I would like to talk about is this Da Vinci single port robotic platform, which is again FDA approved. Interestingly, this platform was not originally developed for endoluminal surgeries. It was supposed to be a platform to be used for single port surgeries or single site surgeries. But we later on realized that the gel port, which is used for introducing the instruments during a single port surgery, can also be introduced through the anorectum, and thus it can be used for doing transanal surgical procedures also. In fact, this is what has led to the birth of the robotic transanal minimally invasive surgeries. So this platform also has a single C-shaped arm with a single robotic port, which has 4 built-in operative channels. So from one of these channels, we are going to introduce the flexible 3D telescope, and through the other 3, we are going to introduce 3 flexible robotic instruments, and each of these instruments has 2 joints and 7 degrees of freedom. In fact, all the instruments and the camera itself can be rotated by 360 degrees. thus giving us incredible field of view, maneuverability, increased precision during our procedures. So this is what the Da Vinci single port robotic system is. Through the single overtube, the flexible endoscope as well as flexible robotic instruments are introduced through the natural orifices into the narrow lumen. And once inside, we can angulate the endoscope as well as our robotic instruments. And you can appreciate here that with this degree of angulation and having two joints at the tip of the instrument, you have the perfect and the desired degree of triangulations, which will enable you to do all sorts of endoluminal and transluminal procedures here. However, the system has its own limitations and disadvantages also. Now, the elbow joint and the wrist joints of these instruments require a significant amount of space to open up. The elbow joint actually requires too much space to open up inside the narrow anorectum. And if you're trying to do that, it can lead to a lot of multiple instrument collisions happening inside the narrow lumen. So this actually compels the surgeon to use only the wrist joint when excising the lower or the distal part of the neoplasm. And the elbow joint can actually be only opened up and used while excising the proximal part of the lesion, which would be higher up in the lumen of the anorectum. Another very interesting and promising platform is this Hominis robotic platform, which has come out of Israel, which is again FDA approved. In fact, this is the first system to be approved for use in single-site natural orifice laparoscopic assisted transvaginal benign surgical procedures. So very interesting platform which can be introduced transvaginally, and once inside the pelvic cavity, these flexible robotic arms can be angulated and surgeon can perform the procedures on the uterus or the adnexa using this. Another very interesting platform is what is known as the EASE, or the Endoluminal Assistant for Surgical Endoscopy. This is actually a descendant of the original Enubiscope, which was a flexible endoscopic system initially developed for doing Notes procedure. This came out from a collaboration between Karl Stoss and IRCAD. So it was later on developed for robotic system and was called STRAS, but now it has been further upgraded to be used for endoluminal robotic procedures, and the name of this platform now is Endoluminal Assistant for Surgical Endoscopy. It's a CE certified platform for use in both endoluminal as well as transluminal surgeries. Unlike the other robotic platforms, this requires the manual insertion of an endoscope through the bowel, just as if you're doing a conventional standard flexible endoscopy. And alongside this, the surgeon is going to introduce two robotic arms, and there is one additional channel through which a conventional endoscopic instrument can also be introduced. The endoscope actually has a tulip shaped tip that avoids the use or the necessity of an overtube in this system. Now, K-Flex is another flexible robotic platform coming out from Korea. It's a fully developed system which is being successfully tested in the labs for doing procedures such as ESD in the stomach or the colon. So again, it has a bendable overtube and a robotic arm which is controlled by the surgeon who is sitting at the master control. The two robotic instruments which are part of this system, they have two independent bends at an angle of more than 100 degrees in each direction. So in addition to all this, the master control monitor also has a graphics simulator which can actually pinpoint and show the position of the robotic arms inside the GI tract. So this is basically how the K-Flex system looks like. So it has these bendable overtubes, which seems to be a common platform for all kinds of robotic systems. And you can see this is a demo video in which the surgeon is testing the master, is holding the master control and manipulating the robotic instruments there. This is what the K-Flex overtube looks like. These movements are controlled by the surgeon sitting at the console. And using these flexible movements, the endoscope is advanced to the target of surgery. And once there, these flexible, strong robotic arms are introduced alongside the overtube, And just to demonstrate that the instruments may look very slim, they are however very strong in their grip. Moving on. Another very promising system is this endoluminal surgical system, which is coming from EndoQuest Robotics. It again consists of a surgical console for the use of the surgeon and has a bedside operating platform that can be attached to an overtube, which in this system is known as a colibri scope. Interestingly, departing from the standard design of most of these systems, the ELS system basically has 6 operating channels. So, 2 channels are used for the flexible surgical instruments, one is used for the flexible endoscope, and 2 are used for insufflation. In addition to these, there is another additional channel which can be used for your bedside assistant to introduce one more instrument while you are operating. Colibri scope, which is coming out from Houston, Texas in the US, is another flexible robotic system which is designed only for transanal surgeries. Again, it has a robotically steerable colibri scope through which a video scope and 2 robotic instruments can be introduced. The overtube is flexible and can be delivered transanally up to the proximal colorectal area, and it permits the rotation along its long axis, allowing the surgeon to work within that narrow space. This is just a demo video demonstrating the use of a colibri scope. It is not approved as of today, but it is being widely tested across some center of excellences across the world, and very soon it is hoped that this is also going to enter into the market for clinical use. The last system which I would like to talk about is this Endomaster Ease system, which is coming out from Singapore. Again, a flexible endoscope and 2 robotic arms. However, this system requires 2 endoscopists to perform a procedure. The operative one on the console, which is controlling the arms, and a bedside assistant who is controlling the actual endoscope. So definitely the standard design is the same in most of the robotic systems. However, different platforms are trying out different things and seeing what works best in different situations. So again, just a demo video of the Endomaster Ease system being tested in the labs. So a lot of promising results are coming out, and we are hoping to see more of this system in the near future. So all the systems which I have been talking about till now have been designed and developed for GI uses. Interestingly, there are many flexible robotic systems which have already been developed and introduced for non-GI endoluminal procedures to be used in bronchoscopy, ureteroscopy, and even endovascular procedures. This is Monarch system, which is coming from Auris Health, and it's already FDA approved for endoluminal bronchoscopic surgeries. So the concept remains the same. This is a fine steerable scope which is being controlled by the surgeon using this joysticks. It can be negotiated into the narrow airway channels, and the surgeon can do a diagnostic as well as some therapeutic procedures through this flexible robotic system. A similar platform is this Ion from Intuitive Surgical. Again, FDA approved, has the same concept of working, a highly steerable, flexible robotic endoscope along with robotic flexible instruments allowing you to do endoluminal bronchoscopic procedures. RoboFlex Avicina is the first commercially available flexible robotic system for endoluminal ureteroscopic surgeries. Now, the robotic arm here can hold a variety of the commercially available ureterorhinoscopes. The system is quite promising and has successfully been used for doing all the current flexible ureteroscopic procedures. The overall success of the surgical procedures is similar to those of conventional laparoscopic surgeries. Now let's talk a little bit about the robotic platforms which are available for endovascular procedures. There are quite a few of them actually. There is a Megalan system, there is a CorePath, there is Sensei X, and there is R1 from RoboCath. All of these systems have either the FDA or a CE approval or even both. Just to convey the sense how these procedures are done, this is a short demo video of the R1 RoboCath system, which is used in the cath labs. So in a conventional cath lab, the cardiologist, the physician used to work here, and the risk of exposure to the radiations was quite high for the surgeon itself because of the extensive use of fluoroscopy during these procedures. However, with the advent and the introduction of this R1 RoboCath system, all the job is basically being done by this robotic arm. The guide wires are loaded onto the robotic arm like this, and after that, the surgeon is going to sit comfortably and safely behind a console and control this robotic arm, which is actually going to introduce this guide wire and negotiate the vascular channels here. So this is how this system is working and actually changing the way in which cath labs are operating. So you can see under the guidance of the fluoroscopy, the guide wire is being advanced. And the surgeon is sitting behind the console and actually controlling the robotic arm, which is doing this job. Okay. So what is the current status of these robotic platforms? So we know that technology often arrives before its perfect application, and innovation always precedes the routine practice. So flexible surgical robotic technology is still in its infancy and its clinical validation is lacking to a certain extent. Research is still ongoing to improve the performance and validity and validate their feasibility. So we are yet exploring the possible indications for a flexible surgical robot for endoluminal and transluminal procedures. Today, these systems may look experimental, but so did laparoscopy in the early 1990s. This is a very interesting paper from Alberto Azzaro, which actually concluded that the road ahead for endoluminal surgery is still at its beginning. Another very important paper coming out from AIG Hyderabad, which emphasized the clinical validation, advanced training, and exploration of newer applications of these platforms. And it mentioned that these platforms promise to overcome the existing limitations and actually revolutionize the management of GI diseases and then obviously improve the patient outcomes. So, as of today, these are some of the important challenges which endoluminal robotic surgery faces. It's not just about the high cost or limited triangulation and a limited working space, it's also about a steep learning curve. And the use as of today is limited to very selective clinical scenarios. There are lots of regulatory and access issues. And of course, we want our robotic platform systems to be a very ergonomic interface. So these systems, they do give us 7 degrees of freedom, but they also limit our freedom of movement. So we need instruments which are not only flexible, but also strong and stiff. The currently available flexible robotics instruments completely lack the tactile feedback. Not only that, there is also no tissue interaction force sensing. The surgeon has no idea how much the tissue which he or she is handling, how much pressure is the tissue being subjected to. Then there are no advanced energy sources which are compatible, which can be used along with these systems. In fact, these systems as of today are good only for some local excision surgeries, and they are unsuitable for any kind of oncological resections. However, with the integration of artificial intelligence, with miniaturization of these instruments, improved design of these instruments, we are actually looking towards a very promising future as far as the application of these platforms is concerned. It's not only about GI or vascular procedures, we are exploring other avenues for the use of these endoscopic platforms, and metabolic therapies seem to be one area of huge interest where we are discovering or looking forward to a lot of role of these platforms. So ladies and gentlemen, just to conclude my talk, I would finish by saying that the platform above can only be considered a bridge towards a real endoscopic or endoluminal robotic surgical system. We are not there yet, but it's safe to say that we are getting there. It's a question of not whether, but when will endoluminal robotic surgery become a standard of care? And it's just a matter of further R&D and training us. So the surgery of the future may not be defined by the incisions, but actually by navigation through natural pathways. The question is no longer whether endoluminal robotics will evolve. The real question is whether the surgeons will evolve enough to be able to use this new modality.